Last session, we passed House Bill 1103, making several changes to APD functions in an effort to increase transparency, reevaluate how funding is determined for iBudget enrollees, and allow families of individuals with developmental disabilities more of a voice without changes or about changes needed in APD programs. House Bill 1103 also expanded the Intellectual and Developmental Disabilities Pilot Program, but updates on that will be addressed in a separate meeting before the Health and Human Services Committee. In a moment, you will meet the new director of APD, and that is Director Bob Azstalos. Thank you for making sure I pronounce your name correctly, who will brief the subcommittee on the agency's implementation of House Bill 1103. Director Azstalos, thank you for being here, and you are recognized.
My name is Bob Azstalos, and I am the Director of the Agency for Persons with Disabilities. And I'm excited that the governor has entrusted in me to implement his policies for individuals with developmental disabilities. I know that that population means a lot to the governor, and it means a lot to me that he's letting me spearhead his policies. I've worked with many of you in the past on veterans issues, and I want to continue that working relationship with you all, taking care of this special population. I put this slide up here because this is the agency's mission statement, but more importantly, it's for the faces, because we're going to have conversations about numbers and policies, and I think it's always important to remind us that every number and every policy is a face, and it's a human being who counts on our services. And we always got to remember that, and I like to always remind myself of that before we start. So I'd like to get into the 1103 implementation, which you all invited me here to come speak about. But before I do that, I want to get into the bigger picture about 1103. And the first thing I want to do is I want to thank the legislature for House Bill 1103. And I want to thank you for it because I think that the bill has identified real processes and real procedures that need updating. And the other thing too, and that's more important, is that you gave tools to APD to implement these policies. And so with that, I just want to share with you that the agency enthusiastically is working to implement the policies and procedures and updates that this bill has. So with that, let me move to the first issue, which is the algorithm. And in it, you directed us to get a study done on how we could improve the algorithm, and that is due to the legislature by November 15th, 2025, which is a very ambitious date, but we're going to meet that. But I want to just share a little bit of history. So what is the algorithm and why does it need to be updated? Well, the algorithm for us, that is the starting point for figuring out how much money for services we would give a client. We use the algorithm to give us a readout of what the individual needs are, and then we do an individual assessment that looks at the algorithm and looks at the client. And if the client needs additional resources, then they submit what's called a significant additional need request, or a SAN request. Now, the algorithm was last updated in 2016, so it's nearly 10 years old. And since that time, there have been new advances in technology, new advances in there's been additional appropriations. So really, we are at the point where it really does need updating. And a validation of why it needs updating is if you look at SANS requests, so additional requests for services beyond what the algorithm has come out with, they've increased about 30% over the last 4 years. And I think that that's part of that reason is it demonstrates that the life of the algorithm is coming to the end. So with that, you asked us to contract out. We put out a request for quotes in August. We did not get any vendors. We reached back out to anyone who had interest, but they felt like it was a hard time reaching the timeline. So then our staff worked the phones, and they worked the phones hard. We found a company called ISF Inc., which they do public and private. They provide services for the private and public sector. And there's a group out in Austin that took on this. And I'll tell you, I've been working with them, and I think they're doing an excellent job. They finished the first phase where they looked at our current algorithm. They looked at problems of the algorithm. And now what they're doing is they're doing other modeling. And we expect that report to be done on time and submitted to the legislature November 15th. And we're going to look forward to working with you on implementing a new algorithm. Next, reporting transparency. You directed us to put some reports, waiver claims reports, service utilization reports, and then the number of individuals in pre-enrollment category by county every 5 days. And we've done that in July and August. But I want to talk bigger picture about transparency. For us, I hope that you have had a chance to look at our website. We have made our website extremely robust, and we are putting more on here than just what you directed, because empowering families, as I go out and I talk to families, they are so hungry for information. And so we are making our website more family friendly, easier using. And I just want to give some examples of some of the things that we've done. And these are just a few examples. My phone number, my direct phone number and email is on the website. Every day, there isn't a day that goes by I don't get a call or an email from a family member or a provider with some situation that they can't work out with the people who are underneath me. And I personally take these and I find whichever staff person is responsible, and we work it out and we work it through. Because customer service has to start with me. And if customer service starts with me, we'll instill that culture within the agency. And so that is on the website. The other thing that we are working on is a family resource page. I want our website to be the premier site that if somebody needs services for a loved one, they come to our website. So we are looking at creating a page, and we'll have it done by the end of the year, that's simple but comprehensive to lay out what the services are and how you go about obtaining those services, one spot. The other thing that we're working on, and this is I am incredibly excited about, for those of you who worked on the senior long-term care side with AHCA, there's a site on the AHCA website called Florida Health Finder. And all of you may be familiar with it. Florida Health Finder is an AHCA licensed facility or on their website. So you could go in, you could put in your zip code, and up pops the nursing homes, the ALFs, the adult daycares in your area, whatever you're looking for. And then it tells all about them, what services are provided, who owns them. And then the last thing is it has quality scores. So we have partnered with AHCA that APD facilities will now go on Florida Health Finder. So group homes, foster homes, and ADT programs will now be on Florida Health Finder so that people have an easy source to find providers in their area or anywhere else around the state. That's the first phase. That'll be done by the end of the year. And then our next phase that we want to do is we want to take our inspection reports and also put that on Florida Health Finder with the providers so families could look at quality too. So those are some of the things. We've created a monthly newsletter because we want to get out important information. We want to get out information that educates them about what our staff is doing, but we want to get out important information. So we've created a newsletter, and we are sending that out to providers and our staff and clients and family members. We're building the list and we're getting it out. So on transparency, we are committed to going way beyond 1103 because information is power for families, and we want to empower families as much as we can. This right here is just, this shows on the website where our reports are at, easy to get to. You go to resources page, agency reports, and there they are. And this is just a small sample. Basically, the direction to the staff is, if we do a report, if it's a public record, let's put it on the website. Let's let the public see it. Let's let the public see the data that we're reporting and everything. Because again, sunshine is the best formula to finding problems and then allowing us to fix problems. Next is the online crisis enrollment. And this is that the Senate Bill 1103, House Bill 1103 directed us to basically create an online application for crisis applications. And so we launched in December 2024 our first online applications for eligibility. As far as the crisis applications, we're actually going to start testing on it. We've developed it. We're going to be testing it in November 25, and we will have the crisis application done before the end of the year. But today, what we did as a preview to it, to assist families, we created a crisis application interactive quick guide. So basically, it's one page that we put on our website, and you can find it. We actually have it in our banner right now because it's new. And so what this guide is, this is step-by-step how to go through the crisis application process, what documents are needed, and how it works. And again, we did it simple, one page, and that's already live, and that will go along with the application. The next one is qualified organization selections. We have to notify clients of the qualified organizations in their region, and we have to make sure that any client who comes on for services within 5 days of enrollment in the iBudget receive a list of the qualified organizations in their region. We've implemented that process, and then August 21st, that went live, and so that's in place too. But we actually go further than that because federal law requires us that we have to provide the maximum amount of information. So we also offer the waiver service coordinators to them too. So not only the qualified organization, but the waiver service coordinators. And that's in case people may want to stick with an individual, and so that gives them the opportunity to do that. And here we have, this is just an excerpt from the letter that we send out to our clients, and then this is where they make the selection as to what support coordinator is they are selecting to provide the services. This right here is this is an example of the list of QOs, qualified organizations within a region, and here too, what we do is we have waiver liaisons in our regional offices who will work with family members if family members need help with this. The other thing too is I would like to add is on our website, we have added a search tool for service coordinators. So you can go in and put in your county, and all the WSCs in your county will come on up. And we also have their consumer satisfaction scores there. So again, empowering families, empowering our clients, that is what we are all about. Okay. This next one is the managed care pilot and expansion of the managed care pilot. And I know we're going to talk about that greater in another committee. But I did want to say there were some mechanical things that you want us working with AHCA on, which we are doing. But I want to talk a bigger picture because the agency is doing much more than just the mechanics, the support role with AHCA. I mean, one of the things about the managed care program is managed care in the general sense, and this population can be risky. But Florida is really doing it right, I believe, as far as a pilot program with this population. And I believe Florida is doing it right for two reasons. One is it's a voluntary program. And so we know that people will go to managed care, and for some people it'll work, but for some people it may not. You allow family members to choose, and their clients, that they can leave a managed care voluntarily and go into the iBudget and receive services after 1 year. So it's voluntary. The second thing is Florida Community Care. My experience on the senior long-term care side is they are a responsive company for services. And so I think Florida Community Care, we have had excellent communication. I've been down to South Florida. I've met with their leadership. I think they want to do the right thing. And so for those reasons, we as an agency are coordinating more to help promote the managed care program. I'm working with Secretary Harris closely as to how we can coordinate. Our staff are all coordinating. I've been to a town hall meeting that Florida Community Care did, and spoke at that town hall meeting. I have done a video for the managed care pilot program, and probably more importantly, family members are scared about managed care. There's a lot of information out there. Some of it's good, some of it's not good, and family members are just scared. And I've sat with family members, and I've talked with them about it, and I've said to them that, look, this is a way to get services where you may not be able to get services. And you can try it, and if it doesn't work, you can leave it. And I think that family members need that message, and that helps them. So the bottom line is that APD, we're committed to working with our sister agencies, working with the legislature to make the pilot program work. Because the bottom line is there's 809 people right now who are getting services in the managed care. And if it works, 2,108 people come off the pre-enrollment list and they get services, and that's a good thing. And everyone should be working towards that. Next is the family care councils. So within the legislation, the legislature laid out some ambitious steps to ensure family input is there in policymaking, and that we have strong family care councils. And I will tell you, the system is not there yet. There are things in there that we're supposed to do mechanically, which we're working on to assist them, where we are finalizing our drafts for operating procedures and bylaws for the new statewide council. We're working on training materials for the councils, and we plan to roll them out in January of 2026. But the bigger picture on the family care councils is, I come from the nursing home profession, right? Family resident input is extremely important. It drives our policies, and also effective family councils are ombudsmen and solve a lot of problems. So I understand the importance of it. I think that we as an agency are committed to working with the families to get to the point where the bill wants us to go. The family care councils have done statewide meetings, and my leadership has been on them. I was in Jacksonville at the Connecting the Dots conference last Friday before last. And I was there with 500 family care council members and family members talking about this. And what we as an agency can do for them is we can assist the family care councils get to where they need to go. And what I offered to the family care councils to put together a group. Let's bring a group in, let's sit down. How can APD help them create the systems that they need to get to what the bill entails? And then also, if there are things that we need to work on together that we can help them as far as policy changes, we will help them get there. But I will tell you this, I'm committed to making these family care councils work. They're not there yet, but we are going to put our resources to make them work. The last issue is transition planning with DCF. And we operate with mutual agency agreements together on our clients where we share, where we cross our boundaries. And I've been down to our regional offices and looked to see how well it's working. And our regional offices are generally co-located with DCF offices. So there is a lot of communication that goes on at that level. There's a lot that gets solved. Sometimes there's friction, but they generally work it through. But also, since Secretary Hatch over at DCF came from APD, she's well aware of our mission. We have an open line of communication. So things that do need to bubble up to our level, we have a good working relationship and we will solve those problems. So with that's my update on the specifics of implementation of 1103. As I stated at the start, APD is fully committed to carry out this statute and even to go beyond it. And to go beyond it in places where we can improve customer care, improve systems and efficiency, make us more responsive to providers, clients, and family members. And lastly, to be good partners with our stakeholders in the legislature. So with that, I thank you for letting me testify, and I look forward to answering any questions.
Thank you, Director Azstalos. You and I have had many conversations since you've taken over the reins. Being a horse girl, I have to use that analogy. I really appreciate your engagement. I think that serving as chair last session here, the committee is very passionate. We want to see outcomes. You know, this population deserves that. And so, again, I really appreciate your engagement. I know you've only been here for a short time. I loved your word friction. I heard it in our healthcare budget when you presented. I've really been looking forward to you being here today and presenting to the committee. And I think we will continue to see great outcomes from this past legislation and, of course, you being involved. And I just appreciate you being very accessible. You've helped me with constituents throughout the entire state of Florida, not just in my particular district. So that being said, I will open up to questions from our members, and Representative Alvarez, you are recognized.
Thank you, Madam Chair. Director, thank you so much. As you made your presentation, I could tell in your voice you have a passion for what you're doing, and we do appreciate, because this is such an important matter. But I want to bring you back to the last slide, which is slide 13, if you don't mind.
Oh, slide 13?
Yes, sir.
Yes, Representative.
Under legislative direction,
Yeah.
it requires APD participation in DCF transition planning for young adults with development disabilities in extended foster care and transitioning from the child welfare system. Mm-hmm. So it's a two-part question that I will need your assistance on. Exactly what expectations are being communicated, and also how are they being received by DCF?
You're recognized.
Okay, thank you very much, Madam Chair. So we do this at the regional level, and what I found going down to the regional level and actually watching them work as I was getting ready to look at the implementation of this is that what I am seeing is there is a good working relationship, I think, at the regional level, where when we're looking at transitioning, children transitioning either way, that a lot of it is coordinated, it's being done there. Sometimes there is some friction, right? Because DCF thinks differently than APD. But I've noticed in the experiences that I've had that they get in a room and they work it out and they get it through. Because a lot of times you're dealing with children who are in crisis. And so you don't have time. and you got to come to a conclusion. So it's two agencies, right? We got two different policies, but I find that our regional people do work together.
Thank you so much. Thank you, Madam Chair.
Thank you, Representative.
Representative Greco, you are recognized.
Thank you, Madam Chair, and thank you for being here, Director Azstalos. I enjoyed the conversation we had in my office, I think just last week.
Yes.
I wanted to talk, at the beginning of your presentation, you talked with us a bit about the algorithm and some of the changes to the algorithm. I had a couple questions I want to ask about that. One of the things you I think correctly noted was that times have changed, needs have changed, technology's changed, and so that obviously you're updating the algorithm to include things that weren't previously included. One of the things that I know we've heard is that transportation is something that in the past has not been concluded, was required to SAN. And I wanted to ask if the algorithm updates that you're looking at will include transportation.
You're recognized.
Thank you very much. You know, I don't have an answer to that one, but I will get that for you.
Okay, no problem. I appreciate it.
Yeah.
Chair, may I follow up?
Yes, you're recognized.
Thank you, Chair. Director, I guess broadly speaking, can you talk with us a little bit about what some of the updates will be and what some of the new services that will be included in the new algorithm that aren't in the current one will be?
You're recognized.
Thank you very much, Madam Chair. We are not at that point yet where we have that. What we have is we have the first phase assessment, which looked at the existing algorithm, and it looked at the flaws in the existing algorithm. And much of this is very technical, way beyond my IT experience. The second part of it, which they're working on, is the replacement model. And once we have that, we'll be able to answer that question. But at this point in the process, they're not there yet.
Follow up.
One more, Chair.
You're recognized.
You mentioned that you were looking forward to working with us on implementing the algorithm. So I did want to, just from my understanding, ask mechanically, when you do have the new algorithm in place, what is the process and the timeline for that algorithm to supersede the existing algorithm? Does it require legislation? Is it rulemaking? Can you talk with us about that?
You're recognized.
Okay. Yep. Thank you, Representative. So once the algorithm comes into place and all parties are satisfied that this is a good methodology and this is where we should go from the report, then we would initiate rulemaking and we would implement it through the rulemaking process.
Thank you.
Thank you, Director.
Representative Abbott, you're recognized.
Thank you, Madam Chair. I want to go to the statewide council. One, I want to know how many members are we trying to put on that council? I see we have two applicants. Have those two been appointed to the council, and how many are we trying to get to?
You're recognized.
So Representative, the statewide council, I believe, has 15 members, if I'm remembering right from the statute. And there are two applications in. The two applications that are now in the governor's office are for local councils, and they are pending. So right now, we don't have applications in for the statewide office. And again, Representative, this is one of the things that I want to work with the family councils on to assist them and help them in the vetting process.
Follow up.
Thank you, Madam Chair. So what is the advertisement plan? I mean, if we have two applications and they're for locals and we want a statewide board of 15, how do we get that message out? And what's our plan to try to encourage folks or reach the right people so that we start getting those applications?
You're recognized.
Okay. Thank you very much, Representative. So the pool is out there. I mean, the pool are family members who are involved in the process. The bill spells it out very well. I think for us, let me step back a little bit. Some of the local family care councils are active and doing well. Others are not so active. So I think the plan really is to reach out to those who do have an active family care council, get them beefed up, and then also to move into those areas where they're less active. I think for us, it's not an advertising campaign. It's more recommendations from people who are in the process. And so what I need to do and my staff is engage with those families who are in the process, actively recruit them, or have the other family care members, maybe more appropriately, actively recruiting in the communities that we need it.
Next, we have Representative Hodgers. You are recognized.
Thank you, Chair. Thank you for this presentation today and for coming to my office last week and helping me get up to speed on all these things. You just recently mentioned 2 councils have applied. Can you say which 2 councils those are?
2 members.
You're recognized.
Thank you. 2 members have applied. They are from the local council in Region 13. Region 13 is the swath that goes from Wildwood to Brevard, south of Orlando. So it's Central Florida. It's our Central Florida region.
And the other?
No, those are the only 2 that have come in so far.
Okay. And follow up?
You're recognized.
I understand that you have said that the applications were already submitted to the governor's office, correct?
You're recognized.
That's correct, Representative.
All right. And
You're recognized.
there's 45 days for him to be able to review this and approve this. Do you know where we're at in that time frame? And if he doesn't approve it, what will you do at APD then if he doesn't approve it?
You're recognized.
Okay. So Representative, I don't have an answer where they are in the time frame, but I will get that for you. And the statute lays out what happens if they're not approved. If they're not approved within 45 days, the local council, according to the statute, can make the appointment.
All right, thank you.
Thank you. Next, Ranking Member Robinson, you're recognized.
Thank you, Chair. And I have 2 questions. I want to follow up on where we are with the council. So that last bullet says that it talks about the 45 days, and it talks about recommendations. So I'm still not clear on who's making the recommendation. Could it be anyone, or is it someone specific? It says that the governor will make the appointment, but on recommendation. So I'm trying to see who should be making those recommendations.
So the statute lays out the process as far as the recommendations. The recommendations come from the councils.
Okay.
So it comes from the members of the councils up to the governor's office.
Okay. I just wanted to get that clear.
Okay, follow up? Yes, you're recognized.
I got that right, Corinne, right? Yes, okay.
Okay.
You know the statute better than me. I would be looking it up, but thank you.
Okay, thank you. Now, my next question, it has to do with the reporting of transparency, and I definitely want to say that you all have done a great job on, getting the individuals with the pre-enrollment categories. We appreciate that. That's really looking good on the website. However, I wanted to know if the agency intended to make any more improvements so that the data can be more interactive, so that we are able to use it, people will be able to use it a little bit more.
You're recognized.
Thank you. So if you have any ideas how we can improve the website, I want to hear it. Because again, I don't have all the answers, right? I'm not a struggling parent, right? I just don't have all the answers. But if there is constituent who've come to you and want additional ways to use our data, please let me know and we will implement it.
Follow up?
Just a follow-up statement. I would
You're
just
recognized.
suggest that, thank you, Chair, that, look at, I know we did some work with the Baker Act dashboard.
Yes.
I think that would be a good guideline for you all to look at.
If I could, Representative, I'd love to follow up with you. Maybe after the committee meeting at some point, we could follow up. And I'd love to get more ideas.
Thank you.
Representative Escamani, you are recognized.
Thank you so much, Chair, and I apologize, my voice is a little bit sore after losing it over the weekend. And it's great to see you, Director, in this new position. Always enjoy working with you, and I'm excited for this next chapter. I have a few questions. I'll go through the chair. So just on slide 8, as it pertains to the waiver support coordinator, based on that's the sample from the form, but also the process, if the individual doesn't respond back in a timely fashion with their preferences, if you will, their choices, the agency will choose someone for them. Maybe just clarity on it. What is the timeline for that? And also, how will the individual be notified of who their support coordinator is? And what timeline will they get assigned one if they don't choose one?
You're recognized.
Thank you, Representative. We don't just send a letter. So we do follow up with an email. We follow up with a phone call. And there are instances where our people go to the House, but we try to get an answer out of it.
Right.
We're trying not to be faceless bureaucrats.
Right.
I mean, when you talk to family members, I mean, just touching with them, right? Is just important. And so, anyway, we are going the extra mile.
Okay. And then follow up, my Chair.
You're recognized.
Thank you so much. One of my constituents actually has a child with autism, and they received the notice of ineligibility for services with APD, and they are appealing that decision. But I wanted some thoughts on, I know we're obviously revisiting the algorithm as it pertains to funding, but who actually reviews these letters? Is it an automatic process? Is it multiple staff who look through them? Because candidly, the constituent was very frustrated because the way the letter was written was as if the child wasn't autistic enough to receive benefits. And then the letter still uses language like mental retardation, which I know we've eliminated from state statutes. So I was curious of why a letter from APD would still use that type of language and outlining criteria regarding the qualifications of a child to receive the iBudget waiver.
You're recognized.
Thank you. I would love to see that letter.
Okay.
That's the first part of the answer. I would love to see that letter. The other thing too is that we do have clinical teams and we have behavioral analysts who also do review the algorithm and review the client also for their needs. So it's not an AI process, right? It's
Okay.
It is. We do have clinicians involved with it. And I will tell you, to answer your question, autism's a very tough one because, the level, don't forget, so this is a waiver service. So by definition, to be a waiver service, the person has to be at the level of institutionalization. So even for someone with autism, they need to be at the level of institutionalization and then also to have communication challenges. And so, I see it. I talk to family members who are just below that line and they're struggling hard,
Right.
but they're not at the level. And so autism is something that, at some point, the legislature and all of us are going to have to address.
Okay. And just a follow-up, Chair, if I may.
You're recognized.
Thank you. And can I get a commitment, if you will, that the language of, because the way it reads is mental retardation or intellectual disability, can we just strike that language out of letters that parents receive? Because we've removed that language from statute, and I don't know why it's still present in this letter.
You're recognized.
You get me that letter and we will follow up.
Okay.
I will personally follow up.
Thank you, Director. I appreciate that.
Okay.
And then one last question, Chair, if I may.
You're recognized.
Thank you. I appreciate you amplifying the managed care program being voluntary, and that's a huge, huge concern for all of our constituents. Any insights on maintaining it to be a voluntary program under your leadership, or do you have any thoughts to maybe what you see as the future of managed care at this point? Might be too early of a question to ask, but I'm just curious of your thoughts to that.
I was actually going to pivot off HB 1103, but apparently Escamani, as usual, is trying to beat me to this. I'm not sure that you can answer that question because I don't think it's up to you, but if you would like to respond, you're recognized.
That was a great answer, Madam Chair.
Okay. All right, I don't believe we have any further questions, but yes, I would like to just end with pivoting about a few things that have been top of my mind because I receive a lot of emails and phone calls from constituents throughout the entire state of Florida as being chair of this committee. When it comes to the website improvements, and thank you, I see that you've already tackled a lot. We've come such a long way from this time last year with the website and it being more user-friendly. But the online application and the status, we've only had one status in the past, and that was basically a status of received. Where are we on this improvement?
Are we, Madam Chair, are we talking about the crisis application or are we talking about the eligibility application?
Yes.
The crisis application will be online by the end of the year.
Okay, and with regard to the eligibility status,
That's,
it's already, there's multiple statuses other than just received, the online
the
application
online-
process?
the online, it is active and it is working.
Okay. All right. And then finally, I would like for you to talk to us about the wait list. How's it looking?
Thank you very much. Thank you very much for that question. For me and for the governor, the wait list and the pre-enrollment list is an extremely, it's priority number 1, 2, and 3 for this population. And as you know, there's 20,000 people on the pre-enrollment list. And so we engaged in an exercise to look at how much surplus money we think we would have at the end of the year. We worked with the governor's office. We worked with the House budget staff. And I am thrilled today to stand in front of you and tell you that last Friday, we were able to send out 5,612 offers for services to people on the pre-enrollment list for iBudget services. And we are excited about it. We've got already 3 family members who've gotten letters and said yes. And so we're excited to expand services to those people who were sitting there. The other thing too that we're working on with this is, so we have a pre-enrollment list, which people interchange wait list and pre-enrollment list. The pre-enrollment list is truly not a wait list. The pre-enrollment list are people who are eligible for services, but many of them are in stable situations because of their situation or services they're receiving elsewhere, and they don't need iBudget services, but they're mixed together. And so one of the things that we are working on is to basically create the wait list within this pre-enrollment list so that we can identify who needs services today. Because right now, when we do mailings out, 50% of the people say that they don't need the services or there's other reasons why they don't accept the services. And so we're not targeting our resources like we're supposed to. So we're gonna work the pre-enrollment list so it's a true wait list, but we are extremely happy that 5,612 people are opening letters right now being offered services.
And thank you, Director, for sharing that additional information. I know you provided that to us in healthcare budget, and not everyone here sits on that committee. So I appreciate you elaborating and being very candid about the wait list and some of those challenges. I see no further questions from any of the members. Thank you again for being here. Looking forward to working with you.
Thank you. Thank you, Madam Chair. Thank you.
Very welcome. All right, members, as usual, you all are rock stars.